Good evening, everybody, participants of this interactive session, this discussion on demystifying glaucoma. My name is Dr. Olagunju, and I'll be the moderator of this wonderful session organized by the Young Ophthalmologists of Nigeria, Young Ophthalmology Forum of Nigeria. Like I mentioned, my name is Dr. Olagunju, Senior Registrar in University College Hospital, Ibadan. And we'll be having two speakers for this great discussion. So without wasting time, I would like to introduce the first speaker who will be giving us the first talk. This program is to enlighten the public on glaucoma, the hazards, the important things you need to know about the speaker. I'll leave everything to the speaker. So the first speaker is Dr. Bisola. The first speaker is Dr. Bisola Ibiyemi. He's a senior registrar in the University College Hospital, Ibadan. He'll be giving us the first talk on demystifying glaucoma. So over to you, Dr. Bisola Ibiyemi.
Okay, thank you, Dr. Olagunju. Thank you, YF, for this privilege to have this presentation at this time of the glaucoma, World Glaucoma Week. So today I will be talking about demystifying glaucoma. I'll try and share my slide now. I'm sure we can all see my slide. Okay. All right. Glaucoma is a disease that damages the optic nerve of the eye, and the damage usually occurs when there's buildup of fluid in the front part of the eye, which is the anterior segment. Usually, there's a channel at which the fluid that has been produced within the eye gets drained out. And then when this channel becomes blocked, then there's buildup of pressure because of the fluid accumulating within the eye. So we could see from the picture, which is showing us buildup of pressure within the eye because of the defective drainage of the aqueous in the front of the eye. The channel through which it goes through is known as the trabecular menstrual. So when there is decreased drainage of this fluid, then there can be buildup of pressure within the eye. So this extra fluid increases the pressure within the eye, and then subsequently, over time, then it starts damaging the optic nerve, which is located at the back of the eye because of that pressure effect. Now, the damage effect it takes a long time, over time, for it to occur, depending on the amount of pressure within the eye. Now, the optic nerve that is being damaged by the pressure that builds up within the eye is actually made of 1 million tiny nerve fibers. We call them nerve fibers. They are high definitive in the sense that each of them subserve a very good vision for the eye. So even if there is loss of this nerve from the buildup of pressure within the eye, the particular individual may not know that this is actually having his vision being lost from this, because these fibers are very high definitive. They subserve very good vision to the eye, and it's like an electric cable made up of small wires, just like it's shown here. However, as the pressure builds up within the eye, then the damages occur gradually. Usually, most time, patient doesn't know that these damages has occurred because of the high functionality of these nerve fibers. So over time, it's when it's almost advanced that most of the nerve fiber is almost dead. That's when patients start complaining of loss of vision within their eye. Yes. Now, some of the things that for people with normal vision, usually you may notice some area of blind spot, but usually for patients with glaucoma, they may not really know, especially in the early stage. It may even look this normal, but in advanced stage, then there's loss of the peripheral vision. We could see in the second picture, it's showing the loss of the peripheral vision, and then patient will just notice that he doesn't know that someone is coming from behind or coming from beside him. If he's a driver, he could easily bump to maybe a car beside him because he or she is actually could not see that his vision in that part of the eye is actually very bad. So usually this usually occurs at the advanced stage when the disease is very bad at that stage. Now, epidemiologically, is said to be the commonest cause of irreversible blindness worldwide, and in Nigeria, is said to account for well, like okay, let me come again. It's said to be the commonest cause of irreversible blindness worldwide, and also in Nigeria. Now, the epidemiology worldwide, it accounts for 8% of all blindness worldwide, and 3.12 million people estimated to be blind from glaucoma worldwide. Now, in sub-Saharan Africa, it accounts for about 15% of blindness, while in Nigeria, according to the National Impairment and Visual National Blindness and Visual Impairment Survey, it accounts for about 1.7 million adults over the age of 40 years, and this amount of people said to have glaucoma. Now, only 5.6% of people with glaucoma are aware of the disease, and prevalence is said to increase with increasing age and is higher in males, usually from the age of 40 years. Now, glaucoma in Nigeria is said to be a little more prevalent in the Igbo tribe than the other tribe. Now, some of glaucoma facts we need to know that is prevalent within us here. Now, like I said, it's the commonest cause of irreversible blindness, and 1 in 20 people over the age of 40 years and older has glaucoma. So it means about 5% of people has glaucoma. And then up to 95% of people with glaucoma are not even aware that they have it. That means by the time you have, let's say you can get about 10 people with glaucoma now, maybe from your skin, almost 9 out of 10 of them will tell you they are not aware. Maybe one of them, the only person that will say is aware that he has glaucoma. And then when you now, for people that are actually presenting with glaucoma, like I said, patients usually doesn't know until in the advanced stage when it's really, really, really bad. Now, about 1 in 5 people that has been diagnosed with glaucoma are said to be blind in one of the eye at diagnosis. So it tells you how bad the disease was and how effective screening would be if actually was detected early for that patient. So some of the risk factors for patients with glaucoma include eye pressure, which is, like I described earlier, it's one important risk factor that has been identified. Although there's really no specific and identifiable cause, but these are some of the risk factors that has been associated with glaucoma. Okay, and it's the eye pressure is very important. Buildup of pressure damages the nerve, like I've described. And I've also mentioned the age in the epidemic, usually from the age of 40 years. As the age advances, then the risk of glaucoma also increases. Then some other studies have shown that diabetes also can increase the risk of a patient with glaucoma. Then also family history of glaucoma, that's very, very important. It's said to, for someone that have a first degree relative with glaucoma, it increases their risk of developing glaucoma. It's even more double, or almost about 6 to 10% times compared to to someone or an individual that doesn't have a family history of glaucoma. Some other things that have been found to be associated with glaucoma include patients with eye myopia, that's short-sightedness. They are also at risk of glaucoma. Studies have also shown that. Then patients with previous eye injury, in which they may have had some other type of glaucoma in them, basically probably not the primary type. And then use of some medications. Usually this type of medications is commonly gotten over the counter or around in chemists because most of these things are just readily available, but they are not being used appropriately. One example of them is the steroid medication, which also increases the eye pressure. And the studies have also found that people with family history of glaucoma or with likelihood to have PAG can also respond to steroid, and then they can have elevated IOP in them. So these are some of the risk factors that has been identified. So some of the symptoms include loss of peripheral vision, like I've described, poor vision in advanced stage, halos, which is described as ring of patients start seeing colors, like different colors around the lights. And then in familiar environment, there's bumping into objects by a patient. Imagine someone walking around in his room and he start bumping into objects, even though he knows something's supposed to be there, but because of loss of the peripheral vision, that individual can start bumping into objects. So some of the symptoms, like I described, I've shown this picture earlier. Extreme glaucoma, we could see loss of the peripheral vision, and then advanced normal vision, then the early glaucoma. Patient may not really know because they could still see very well, and the peripheral vision loss is really not that significant, so they may not know. Most time, patient will present in the advanced stage, in which they will notice they are probably bumping into objects in familiar environment, and sometimes they must have lost vision in one of the eye. So, like we said, the eye is very important, and it's important that we have our eye screen at every point. Glaucoma is the disease that we have in our environment. So the eyes have it. Let us have it screened every time. Thank you.
Thank you very much, Dr. Ibiyemi, for a very brief and enlightening lecture on prevention and treatment of glaucoma, on glaucoma in general. The next speaker is Dr. Ezine Ondebune. She's a senior registrar in the University College Hospital, Ibadan. She'll be talking to us on prevention and treatment of glaucoma. So, over to you, Dr.
Thank you, YUF, for the opportunity to be part of this symposium. So I'll be discussing the prevention and treatment of glaucoma. So the question is, how can you prevent or slow vision loss from glaucoma? For now, we don't know of any proven techniques that can exactly prevent an individual who is predisposed or who is at risk from getting glaucoma, but we know that regular moderate exercises may be able to help, such as cycling, brisk walking, not things like lifting of weights, but moderate exercise that is regular. And we also encourage people to wear eye protection to prevent eye injuries, welders, carpenters, even those who engage in some form of contact sports. So this can prevent the injuries that may predispose some people to secondary glaucomas. Then for people who may be at risk, we encourage them to get regular dilated eye examinations. And it's important that everyone knows their family's eye health history, so that if there are people, especially first-degree relatives, who are at risk of glaucoma or who have glaucoma, individuals can be more proactive in their screening of themselves yearly, or as the case may be, so that earlier stages are picked up. And for those who may have glaucoma, to prevent blindness, they're encouraged to use prescribed eye medications regularly. So we'll be discussing the treatment of glaucoma. So it's important for us to note that for individuals who are diagnosed with glaucoma, treatment is usually for life, as glaucoma has no cure. It's not like after 3 years you become cured. It's like any other chronic disease we manage, diabetes, hypertension, and all the like. So if you have glaucoma, it's important to know at the time of diagnosis that you will need treatment for the rest of your life. Because if glaucoma is left untreated, it will eventually lead to blindness. And also, some people that even though they undergo treatment, they may still become blind. So the glaucoma treatment aims to prolong the period of irreversible loss of vision, so that at the time of diagnosis, you can still retain useful vision for as long as you're alive. And there are several treatment options available for glaucoma. Usually, because the eye pressure, the intraocular pressure is the only modifiable cause that we know, most of our treatment is aimed at lowering the pressures in the eye. That's the intraocular pressure. So there are different options available. Use of eye drops. As you can see in the picture, there is an array of several eye drops that are available in the market in different brands manufactured by different companies. Some of them have daily dosing, some have twice or 3 times daily dosing. So it's important to use the eye drops as prescribed, following all precautions as detailed by the prescribing physician. Even though some of these eye drops may have some side effects, when they are manageable, we encourage people to use them as much as possible. The other oral drugs that can be used in the treatment of glaucoma, some tablets that can help to lower pressure acutely. Then laser treatments are also available for different kinds of glaucoma. Laser treatment can be in the form of iridotomy or trabeculoplasty, where your doctor fires some laser beams to the eye to help to remodel the angle that is responsible for drainage of fluid from the eye. Surgery is also available, where a channel is created that enables fluid to leave the eye, and a combination may be prescribed for an individual. So it's not uncommon to see people who may be using eye drops and oral drugs, or a combination of eye drops after having had laser treatment, or starting with eye drops and having to undergo surgeries at a later date. So a combination may be used for the individual depending on the factors present. But what is also important that we may not always emphasize is support system for glaucoma treatment. Because when people are diagnosed with glaucoma, they have to undergo treatment that is as long as they are living. They have to come to clinics regularly for follow-up to check that the damage is either stopped or reduced at a very slow rate. And even with all this, there's still a possibility of progressive vision loss, especially in environments where glaucoma is particularly aggressive. So it's important that people who have glaucoma can meet and talk with other people so that they can share experiences, share their stories, success stories, and how they're able to cope with the diagnosis. So if an individual is diagnosed with glaucoma, you can ask in your hospital where you're being managed, or the public health officials. Usually the public health nursing department is very, very helpful in this area. They are equipped with a lot of resources to introduce people to support groups and different meeting times available. Also, in this era of online and the world being a global village, there are a lot of support groups that may be available online to help individuals to cope. So that even with reduced physical activities in advanced stages, people are still able to have meaningful quality of vision, quality of life. So there are usually questions on alternative medicine, supplements, and all of that. How helpful, how beneficial they may be in glaucoma management. It's important for us to know that some of these may help in the overall health of the individual, but none of them is as effective as glaucoma remedy, because these glaucoma drugs have undergone different trials in live human beings, in animals, and several studies before they are being brought out for public consumption. And even while they are being used, there are studies that go on from time to time to prove that such drugs are efficacious. Unlike the alternative medicine, that we don't have studies that back up how effective they are for glaucoma. So it's important you discuss with your doctor about any alternative medicine to know the possible benefits and risks. So at the end of the day, the question is, how would you like to live the rest of your life? You can choose between having normal vision, and you can choose to have advanced glaucoma. So our message for the year is that this world is bright, and it's important to save your sight. Don't let yourself to be blindsided from glaucoma, and don't let glaucoma ruin your future. Get screened for glaucoma today. Thank you so much for listening. We will entertain any questions we may have.
Yeah, thank you very much, Dr. Ezinionebune, for that very brief but enlightening discussion on prevention and treatment of glaucoma. So quickly, we'll move to the question and answer session on Zoom. You could just send your questions at the chat section, or you could ask directly. You could raise your hand, then the host will mute you so you could talk. So any question, drop your questions at the Q&A section of the program. So right now there are no questions. I don't know if I don't think anybody's raising their hands. No questions so far. Okay, in the absence of questions, you can switch over to Dr. Ebukon, who will address the questions on YouTube, as there are no questions on Zoom. So over to you, Dr. Ebukon. YouTube.
Good evening, everyone. We presently don't have questions on YouTube also. Okay, so a question just came in. Question says, how can you know that someone has the glaucoma? Question by Ukamaka and Wama. Speaker 1, please.
All right, thank you for the question. How can someone know if there is glaucoma? In the early stages of the glaucoma, like I said, an individual that has it may not know. The chance that that person will know is very small because why? When the damage just started, because of the damage to that nerve fibers, there are about 1 million fibers at the back of the eye, and like I said, they subserve a very good vision to the eye. Now, before a patient will have been aware or start getting notice of advanced stage of the disease. So usually for early stage of disease, most time patients will not know because one is even painless. So when it's starting, it's painless. Patient will not know, but the damage has already started in that kind of a patient. The only way that patient can know is if he or she comes around to the hospital for screening. So which is why we advise that apart from even being glaucoma, patients or an individual, it's good probably at least once in a year to have his or her eye screened by an eye doctor, which is an ophthalmologist, so that they can be able to check the eye appropriately and then make an accurate diagnosis. So for a patient that is being diagnosed early, then the likelihood that that patient will lose his vision will be lesser than someone that is not being screened and is not having his eye checked regularly. So in the early stage, there's no likelihood that that patient or he or she will know that he has glaucoma. That's one big problem, and that's why we call glaucoma the silent thief of sight, because it comes in and creeping gradually to take away the vision. So, which is why we are bringing out this seminar symposium to enlighten the public on the devastating effects of glaucoma in those that will have it or may likely have it. Thank you.
Okay, thank you very much, Dr. Idiyemi. So I'm told that there are no more questions on YouTube. So there are no questions on YouTube, and no more questions on Facebook as well. We'll also check now to see if we have questions on. Okay, yeah, we have. There's Iguilo Daniel Chizoba. He has a question. So the host, can you just unmute our speaker, our microphone? Iguilo Daniel Chizoba. That's on Zoom. Host, can you please? Okay, I think she's placed it in the Q&A section. So the question goes thus: what are the causes of glaucoma and remedy to prevent it? So maybe we should let the second speaker answer that. What are the causes of glaucoma and remedy to prevent it? Very good question from Daniel Chizoba. So over to you, Dr. Ezinio Nebune.
Okay, thank you for the question. There are several types of glaucoma, really. Glaucoma is not just one type, it's a group of optic neuropathies. So the different types of glaucomas may be caused by different things, the primary glaucomas usually are those that don't have any cause, while the secondary glaucomas can be attributed to different causes. Some glaucomas, children are born with it. That's the congenital or the infant, the one we notice when they are infants, we call infantile glaucoma. Those ones usually are caused by abnormal development of the eye structures, the part of the eye responsible for allowing fluid to drain out of the eye. Then there is the kind of glaucoma that we see in older children and younger adults, the juvenile glaucomas. Those ones could be as a result of some genetic problems that will cause some structural changes in the eye that also predispose them to glaucoma. Usually for the primary glaucomas, there is really not much that can be done to prevent them. What we aim is at is preventing vision loss from them. But for the secondary glaucoma, there are different kinds. They are the ones that could arise from trauma to the eye, from different kinds of trauma, maybe blunt trauma, maybe you are playing basketball, you are playing table tennis, you are playing lawn tennis, and the ball hits you on the eye, usually from blunt trauma. Maybe doing contact sports or other kinds of sporting activities. Some may even be from corporal punishment, capital punishment, maybe children who are being flogged in school. So when there is injury to the eye, it can also cause some kind of glaucoma. Then there are glaucomas that can be caused as a result of, so in general, the prevention is for those who walk and play sports, prevent injuries to the eye by using safety goggles, like we advised initially. Then for there are other kinds of glaucoma that can be caused from some tumors in the eye. So those ones is to treat the underlying condition. We may not really be able to prevent the glaucoma from happening. There are also other kinds of glaucoma that can be caused by other eye diseases. For instance, diabetes, hypertension, other diseases that can affect the eye. Diabetes and hypertension, they can cause changes at the back of the eye that can cause some kind of glaucomas. So usually how to prevent glaucoma from those conditions is to treat all those underlying conditions. If somebody is diabetic, should have regular eye checks, should use their medications properly to keep their blood glucose level under control. For people who are hypertensive as well, they should keep their blood pressure at optimal levels. So those are a few of the examples that, things we can do. Then I also mentioned the issue of regular moderate exercises, going for brisk walks, bicycle riding, and those kind of exercises. And also regular eye checks, so that if earlier milder forms of the disease are detected, treatment can be started to prevent the more advanced forms. Thank you.
Thank you, Dr. Nebune. So let's look again to see if we have any questions on Zoom. No more questions here. And I'm told there are no more questions on YouTube and Facebook. So we are gradually wrapping up this discussion. And next up will be, let's just give a brief summary of what we've done today. We've talked about glaucoma. We now know that it's the silent thief of sight. It's a leading cause of irreversible blindness in Nigeria and worldwide. We know that the primary types are really of no known specific cause, but they are secondary types as well that can be caused by some other things like trauma. They affect all ages, both children and adults. But the commonest form affects adults, mainly over 40. Increasing age is a risk factor. We blacks are more predisposed to having this disease compared to the others, and also are known to have the more severe type of the disease. We also know that it can be managed with medications and surgery, including laser procedures. So it's been a very enlightening discussion. The important thing is to know that glaucoma can be, blindness from glaucoma can be prevented if diagnosed early. And the most important thing is for everyone to get screened, including we healthcare workers and professionals. So I would go over to Dr. Ibukun for now, which the organizer of this symposium, to just give the vote of thanks. So over to you, Dr. Ibukun.
Good evening, everyone. It's been an exciting week of activities to raise awareness of glaucoma, and it's been an exciting and enlightening lecture as well. I hope we gained one or two things. Just to emphasize again on the key point, which is go for eye screening, as glaucoma in the early stages is asymptomatic. So I want to enjoin all of us, not just to take this message alone, but also to take it to others outside, to go for screening. Yearly eye examination is recommended, especially if you have a risk factor, such as if you are over the age of 40 years or you have a family member with glaucoma. Let us all cultivate the habits of going for yearly eye screening. To all who joined us today, thank you for your time. We appreciate you. To the president and other executives of the Young Ophthalmologists Forum of West End, thank you for giving us this platform to raise awareness of glaucoma. Ladies and gentlemen, at this point, we'd like to say thank you and goodbye. Have a great evening.
Okay, so thank you very much, Dr. Ibukun. I'd also like to thank the host of this discussion, Dr. Cyril Opasue, and also those who anchored on YouTube, from Dr. Ifi Moyen and the speakers actually of this discussion, Dr. Ifi Yemi Sola and Dr. Ezini Onebune. So thank you, everybody. Remember, the world is bright. Save your sight. Thank you all for listening.